Okay, this is Athena Jezik, and
Sorry, I wasn't moving.
okay. This is Athena Jezik, and this time we're going to do a little work on the abdomen. The abdomen is something that doesn't get massaged a whole lot in massage therapy, although it's a delicate area. There's a lot of organs there. There's a lot of things that need to be moving in a particular direction. There's a lot of lymph nodes in there. And I have learned by taking the lymphatic work that, the quadrants of the body, so I tend to work with that in mind, making sure that the fluids are going to flow in the right direction. So first of all, I'm just going to start by just basically working a little bit of the lymph. What I have found is that when the fluids move, the other tissues seem to be happier. The muscles, because they're not sort of bloated with fluid, it's easier to get in them, it's easier to do the work that needs to be done when you move the water out. So in this case, we're going to just move the water and get it into the lymphatic system, and then I'm going to do a little work for peristalsis and just to get the digestion working. Again, this is something that you want to be gentle with. Anytime going deeply into this area of the body, please do know what you're doing. The organs really don't have a lot of room in there, and they need to move with the movement of our body, so they're constantly moving around each other in a very small space. Okay. Again, put a little lotion on here, a little oil, just to give a little bit of slip. Excuse me. And you always want to go in a clockwise direction because that's the way the digestion runs. It comes down into the stomach and then moves into the small intestine, and we're working as it comes into the ascending colon. And this is done very lightly, just to get a feel for what's going on with this structure. And then I like to start at the back part to move anything forward. When you're in this area, the liver is right here, and if the liver is having some stressing or it's overloaded, it's going to feel somewhat hard, or it's going to feel very tight. If that's the case, then it's a good idea to drain the liver. And then after I get back over here, I'll tuck my fingers underneath the actual ascending colon and be pulling it up a little bit and just feel, just to give it a little stimulation to get the peristalsis working. On the ascending and down the descending. And then the small intestines are all in the middle here. So it's good to massage them in the direction, a clockwise direction. And this is done with a lot with the palm of the hand. I do it with a rather large space. I have a lot of space, a lot of area underneath and on my hand, so I'm covering a lot of the small intestinal area. Basically working it in a clockwise direction. Sometimes by pulling it a little bit counterclockwise, it's like a recoil action. You can coil it and then let it go. But to do a recoil, you can move the hands in the direction that you want to go, and you take it, let that fascia pull you around. You pretty much interfaced. Your hand is interfaced with the abdomen. And then when it feels like it's getting tight, like a tight little twist on it, you just keep holding that. And then to recoil, you just come off real quick. That oftentimes will get things activated. If you hear some noises in there, little peristalsis noises, that's good. When you hear that noise, that's a good sign because it means that things are moving. They're not stuck. Things should feel soft. The liver feels soft. Actually feel a lot of the peristalsis happening in some of the fluids and intestinal matter moving in the body. Okay, and then checking the lymph, I just always go back and make sure that the lymph is moving out of this area in the proper direction. And I'm just slipping my hand underneath her and I'm intending energy to flow it through my hands from palm to palm. And what I'm able to do with that is feel a little bit deeper into the structure as the intestines are back against the back, inside of the back. And again, it's a thing that you get train your hands to feel, and once you find that sense of what's going on and get it into the hands, it becomes like second nature. There's a lot of communication that goes on with the body and the hands. It does take some time to develop. There's a learning curve there. She seems like she wants to go into another recoil. Broad movement up and around, following the anatomy. Our gut health is very important to the overall health of our body. So we should have it in good working order, and it should stay relatively clean. It's a place where we absorb our nutrients, so if it's got a lot of debris in there, we're not going to be pulling the nutrients out of our food as effectively. Okay.
Call my old boss.
Yeah. Okay. All right. All right. Okay.